Transcultural Healthcare, the Hindu-Indian Culture by Elaine Burwell, Bethany Gallagher, Lori Presley, and Donna White. It is estimated that there are approximately 2.3 million Hindus of Indian origin in America, and an additional 1 million Americans that are practicing Hindus. It is not Hindu practice to discuss their religion to outsiders, so Westerners know little about the Hindu religion and the practices of its followers. Healthcare professionals need to know more about the religion in order to provide culturally sensitive care. In this presentation, we will review our research on Hindu-Indian cultural attributes, beliefs, and values, how this community defines health, and the nursing care implications derived from that research. Hinduism is recognized as the oldest religion. Its existence dates back over 8,000 years. There is no known founder and no primary text, but Hindus do have scripture called the Vedas. There are literally thousands of gods and goddesses that all contain a part or represent a characteristic of Brahman, but it is considered a monotheistic religion. Daily worship, called puja, includes lighting incense, prayer, and meditation, and is normally performed in the morning as a family. The primary tenets of Hinduism are reincarnation and karma. Hindu followers are collectivists that believe in the value of cooperation, duty, favoritism, interdependence, nurturing, obedience, and reliability. Time is viewed as cyclical rather than linear due to their belief in reincarnation. They are very spiritual and often have rituals. They often have statues in various forms that represent their gods and goddesses and very specific prayer practices. They may fast or practice yoga for spiritual cleansing and guidance. They observe 8 holy days throughout the year that are based on the lunar calendar and participate in religious pilgrimage. The caste system, although abolished, still remains in the Indian Hindu culture. Hindu Indians have many beliefs and values related to health and illness. The Indian culture is less likely to follow strictly modern medical care. Hindu Indians may assign cultural explanations and significance to everyday symptoms, unexplainable symptoms, and mental distress. Mental illness is often thought to be viewed as someone possessing a weak character. The perception of diet and disease causation is common among the Indian culture. Milk is considered harmful in respiratory diseases because it is cold. Hindu Indians believe that bad karma causes catastrophic, intractable illnesses and death. Prayer and rituals are used to try and rid of bad karma. Hindu Indians will incorporate alternative medicines and prayer into their care plan. This will include body-mind interventions, massage, diet, nutrition, and lifestyle changes. Homeopathic treatment options are popular because they are inexpensive and considered harmless. Holy basil, which is extensively used across the world in Hindu temples, is used in antibiotic making. Modern medicine is only good for acute and surgical conditions. Traditional systems of medication are better for chronic conditions. Fasting is used to cleanse the body. Many Hindus hold strong astrological beliefs and may believe the movement of the planets has a strong influence on health and well-being. Hindu Indians rely heavily on informal systems of social support, such as family and places of worship. They don't broadcast their illnesses to others in fear of social devaluation. The family quietly bears the burden of healthcare needs and issues of their loved ones. This culture believes that health is usually related to the connectedness of body, mind, and spirit. There is usually a large focus on preparing the soul for life after death. The next several slides provide an overview of nursing implications to consider in order to provide culturally sensitive care to individuals in the Hindu-Indian community. For Hindu-Indian women of childbearing age and their families, nurses should be aware of the disparities created by gender discrimination. Females may shield their face by veiling and wear very modest clothing. They may prefer examination by a female healthcare provider. Females are less valued in the Hindu-Indian culture and therefore less likely to receive resources, including access to education, healthcare, and food, which may impact their overall health outcomes. There is a higher incidence of domestic violence, which nurses must be sensitive to and alert to during a patient care interaction. Vitamin D deficiency is extremely common in this group of women due to lack of exposure to sunlight with veiling, modest clothing, and infrequent outings. Vitamin D deficiency in pregnancy is associated with serious and even fatal risks to the child. Screening for vitamin D deficiency, educating on the importance, and monitoring the use of supplements is a key intervention to providing culturally competent care. In the Hindu-Indian culture, a child's ability to relate to others is of high importance to parents in India, so social difficulties are often the first indication of a problem with development. Parents view education as the gateway towards a brighter future in which their child would gradually overcome relative dependence on them. The suggestion that boys just speak late is a consistent finding in the literature on India. Premature weaning of infant girls in the desire to conceive a boy may contribute to gender disparities in child health and 9% of the excess female infant mortality in India. When caring for adult Hindu-Indian patients ages 18 to 64, there are several considerations for the healthcare provider. Because it is not common in the Hindu religion to discuss their beliefs with outsiders, a trusting relationship must be established to determine how to best care for these patients. It is common for the oldest member of the family to make healthcare decisions. If this person is unable to make these decisions, the eldest son of the family is usually the decision maker. It is important early in their relationship to determine who is the decision maker for this patient. When a patient is going to be discharged and cannot care for themselves, who will be providing care? As parents age, it is the Hindu custom that the eldest son and his wife provide care for the parents. However, if the eldest son is not willing, another son will usually accept care. Parents will likely not accept care from married daughters. Designate a portion of uninterrupted time that you can spend with the patient in private to discuss their beliefs and how you can best assist them in providing appropriate health care that is congruent with their beliefs. Do they fast? Is fasting a problem with managing their health and healing at this time? Negotiate between the patient and physician to come to an agreement that is suitable for the patient that will promote health. What diet do they follow? Many Hindus are vegetarians. It is important to alert nutrition services of their diet so that appropriate food can be provided. Family is also invited to bring food in from home if that would be preferable. Because of their belief in karma and reincarnation, Hindu patients may be unlikely to accept some treatments, particularly pain medication, because they believe that suffering in this life pays for previous sins and will be rewarded in the next life. Hindus believe that death should come naturally. It should be not hastened or prolonged. Palliative care is in keeping with their religion. Many times there will be a language barrier in the geriatric Indian population, as many of those patients may not speak English. There will likely be a strong family presence when caring for these patients, as children are expected to care for their ailing parents. Traditional beliefs are still practiced throughout the end-of-life process. Hindu Indians believe that lifestyle affects longevity and health in old age. Hinduism encourages the acceptance of pain and suffering as part of the consequences of karma. Fear of death, ignorance of life's meaning, and sadness secondary to loneliness are common sufferings of old age. A Hindu patient, especially a Hare Krishna follower, may wear sacred tulsi beads, a string of small wooden prayer beads, around their neck. It is important that these be on the body at the time of death. 1/5 of the Hindu-Indian geriatric population suffer from a mental health illness. There are 1 billion adherents to Hinduism worldwide, with 95% living in India. They believe in one true God, the Supreme Spirit, called Brahman. Red and gold are common colors for wedding ceremonies. Marriage is not considered valid until consummation. Hindu narratives suggest that fortunes are shaped both through the divine intercession and through destinies determined by past lives. Hindu practices may even influence some disease patterns. Most Hindu Indians prefer to die at home. Culture is the personal knowledge, religious beliefs, and social behavior of an ethnic group that is passed from one generation to another. Many of the opinions that are formed regarding health care originate from advice from family and community. The nurse should explore what the patient's symptoms mean to them and what, if any, alternative medical care they have used in the past. The clinician should remember that professional advice is often reevaluated by the patient and family, as it relates to their culture before any action is taken. Armed with a better understanding and awareness of this interesting culture, nurses will be prepared to provide culturally sensitive care.